Today we'll be dealing about causative factors of PCOS and symptoms of PCOS. Hi, this is Dr. Bharati, obstetric and gynecologist, fertility specialist working at Caroline John Hospital, Nagarkoil. What are the causative factors of PCOS? The exact cause of PCOS is not known. It is a multifactorial disorder. It can be caused due to ethnicity or genetic link or environmental factors. So environment factors like the diet which we take, lifestyle modification, chemical exposure, occupational exposure. Most common chemical exposure which we talk nowadays about is bisphenol A. So this chemical compound is seen in plastic usage, toys which we use. So this can cause PCOS. Fetal programming. Another cause is like fetal programming, that is fetus exposure to androgens. It can be due to the mother where the conditions increase the androgen level, or fetus itself have a condition that increases the androgen levels. It can leads to or predispose the fetus to PCOS in our younger age. Now we'll talk about symptoms of PCOS. See, commonly we see patients telling about irregular periods or prolonged bleeding during periods or absence of periods, or acne, skin tags, thickening, dark skin, like hair loss or male pattern baldness, excessive pain or bloating sensation during periods, like inability to conceive. All these are the symptoms of PCOS, like even excessive weight gain, all seen in PCOS patients. But these are mostly commonly seen during reproductive age group. But when you see in older age group, the symptoms are different. So where they can have like type 2 diabetes mellitus, cardiovascular disorder, and metabolic disorders, and endometrial hyperplasia. Now I just wanted to clear a myth about irregular periods. That is, if the post menarche your age is less than 1 year, irregular periods are common. If the post menarche is greater than 1 year or less than 3 years, your period duration will be between 21 to 45 days. If it is less than 21 days or greater than 45 days, it is known as irregular periods. If the post menarche is greater than 3 years, the duration of your period is between 21 to 35 days, it is normal. If it is less than 31 days or greater than 35 days, it is known as irregular period. So you can consult your doctor and get treatment for it. Symptoms of PCOS. These symptoms which I talk now is commonly seen around the reproductive age group, that is irregular or prolonged periods or absence of periods. And fluid filled sacs or cysts are seen in ultrasound. Growth of extra or unwanted hair loss or male pattern baldness, excessive cramping, bloating symptoms during menstruation, acne, and other problems, skin problems like skin tags, thickened and dark skin, other symptoms like psychological stress and depression, and difficulty getting pregnancy, mood swings, weight gain. All these are seen in reproductive age group. But in older age group, the symptoms are different, which we see are like metabolic disease, type 2 diabetes mellitus, cardiovascular disorder, environmental hyperplasia. Just wanted to discuss about association between PCOS and obesity. Obesity is seen in almost 50% of PCOS. Rather than PCOS causing obesity, obesity itself increases the symptoms, aggravates the symptoms of PCOS and increases the risk of metabolic disorder. Android shaped obesity, that is like apple shaped obesity, where the visceral adiposity will be increased. They are more associated with metabolic disorder than pear shaped obesity. Even obesity have very negative effect on infertility, where there is an increased gonadotropin and association of obesity with fertility. Obesity reduces have negative effect on fertility and reduces the effect of gonadotropins, implantation rate and pregnancy rate. Thank you. Further details about PCOS is seen in upcoming videos.